Thank you all for joining us. We'll get started here in about a minute or so. Vincent will kick us off.
Morning, everybody.
Good morning. Happy Friday.
Happy Friday.
Yeah, you too. Or somebody I was talking to yesterday was saying, every day is Blur's Day. Today is Blur's Day. Yesterday was Blur's Day. Happy Blur's Day.
Yeah, that's accurate. I like that. Well, I think we can probably go ahead and get started if you want to kick us off, Vincent. Just a reminder, if you're not speaking, just mute yourselves so that we can hear the speaker.
Sure. Hi. Thanks, Aubrey. Thanks for joining us this morning. We're excited to be here with you. We thought that what we'd like to do is start trying to convene our brainwave virtually anyway, maybe quarterly. Figured that we would just get started right away with that, and we'll adapt our content and things as we go along. And for today's purposes, we really just wanted to share some updates about recent policy work and what we're anticipating in the new year. We've got a bunch of different interesting irons in the fire and a lot to share. And we're also interested in hearing from you. So I'm not going to take up a whole lot of time here at the beginning, other than to just reintroduce myself and some of the members of the staff. I'm Vincent Atchity, the president and CEO. I've now been with the organization for just over a year. Also with us, as you've heard, is Aubrey Hughes, our director of communications, and Moe Keller, who's our director of advocacy. I think listening in today, we have our director of operations, David McLaughlin, our operations specialist, Adam Goss, and our development associate, Erica Montgomery. So those are the introductions. I'm going to turn it over to Moe, who's going to share some updates with you. And we're going to have plenty of time for conversation and questions later on. Moe, Flora, I think, is going to start a slideshow, and Moe can take the floor.
Okay, very good.
Yeah, and feel free to interject if you have questions for Moe as well. But we'll also have a time for Q&A at the end.
Well, welcome everybody, Brainwave members and others. We appreciate your taking the time, and we appreciate your willingness to be advocates with Brainwave, because we depend upon you a lot to get our policy moved forward and our legislation passed. And so I think Flora is going to be running the show here. So can you go to the next slide, please? So thank you. 2020 was an oddball year. The legislature, it was historic, actually, in that the legislature did something that it has not done before and actually had to get a ruling from the Supreme Court to be able to do. And that was, they started in January, things were going fine. February, things were going fine. And then COVID hit. So what the legislature wanted to do, and wanted to know if they could do, would be to take a recess in March for a couple of months and then restart again without having those months in between, those days, count against their timeline. In our Constitution, it's 120 days. It does not say 120 consecutive days. This was the piece that we had to have clarity from the Supreme Court. The Supreme Court came back and said, for a couple of reasons, yes, you can do that. So they did a recess in mid-March, and they did not come back until I think it was early May, and they started the clock again then, so that they had enough days to continue. And that was definitely a historic thing. We had never done that before, but now we have set the precedent on it. And so when they did come back, however, it was virtual. It was not in person. That again was kind of a record-breaking formula. They had not done that before. And so everything that we were doing as Mental Health Colorado and our Brainwave members were doing was getting things virtually, testimony written ahead of time into those committees and uploading all of that, and contacting our legislators, which was a challenge as well because they did not have staff. No staff went back. So their offices were not taking phone calls. I mean, you could leave a message, but you had no idea whether they got it. So we had to go to texting because most of them had their cell phones on the floor and we were texting directly to the floor, which meant I was trying to find texting. So all kinds of situations that were made it a novel year for sure. However, while we lost some of our bills because of the cost, COVID created an economic loss to our state because of the lockdown. So we lost a lot of our good bills. However, we did manage to pull out a few that we're happy about. The first is the Safe to Tell update. And you may be aware that Safe to Tell is a anonymous tip line that was created after the Columbine tragedy in 1999, recognizing that youth tend to know way before adults do, even faculty, what's going on with each other and who's potentially bringing a gun to school and that kind of thing. So it was designed to do that. Has worked well. However, we have noticed in looking at the data that over the last, actually, it's been a gradual creep up, but I'd say even the last 10 years, the data in 2018 was shocking. 86% of the phone calls coming in to this line were not public safety related, like so-and-so's bringing a gun to school, somebody's got a bomb in their backpack. It was mental health related. It was, I'm considering suicide. I'm very seriously depressed. I'm worried about my friend. He's talking about cutting himself and injuring himself. And I'm worried. These kinds of calls were coming in. And yet the format was to send the police out to the school. And the police are not the appropriate response for a youngster, high school or junior high, who's crying out for some kind of mental health help. And so this bill bifurcated that call. So if a call comes in and it's public safety related, it goes to law enforcement. If the call comes in and it is mental health related, it goes to our crisis line, our statewide crisis line, and they don't send out police. They send out, if someone's going to be sent out, or they connect that individual to mental health treatment. So that is now law. We got that passed, and we are working now on the implementation of that through the summer and fall on rules. So that was one thing we were able to accomplish. A second bill that we were able to get partly accomplished was early childhood mental health. We had wanted to have funding for mental health consultants and advisors to daycare centers, early childhood, preschool, to help with a child who may be experiencing behavior problems, to wrap around that child and the parents to provide mental health services. We were not able to get funding, but what we were able to do was to get a program design in a couple of capacities into state law, and that's underway right now. So we will have criteria set up, we will have the program set up by law such that when we do get funding, and we're hoping maybe in another year or two, that it'll be ready to roll. We'll have everything done. So at least we're getting that piece. Teacher recertification, we were able to get passed. Teachers, in order to keep their certificate to teach in the state, every 5 years have to have their recertification. They have to take classes. We were able to get into the teacher recertification requirements, a requirement that some of their classes have to be mental health for youth related. So they have to take something in that regard. And we were pleased to get that passed. And then finally, the telehealth bill for behavioral health outreach was passed. As a matter of fact, this is the bill that we passed is considered model language, and I have other affiliates in other states that are now requesting it so that they can pass something similar. But what it does is it creates telehealth as a permanent method of treatment for behavioral health that will be able to be billed for in Medicaid and in the private sector. It accompanied both private and mental health. So we were pleased to get that passed as well. Next, please. So the bills we lost that we were unhappy about, peer support specialists. We have been working extensively, actually, in trying to get peers who are taking training to be specialists in helping with providing mental health services to individuals who are in need. We've been trying to get them recognized as a profession. That was one angle we were taking, but the other was to expand where they can work, because right now they are employed almost exclusively, but not entirely so, at the mental health centers, which is wonderful, and at some of the substance use treatment centers. And that's great too. But we had wanted to expand their ability to work in emergency rooms, perhaps when individuals come in on an M1 hold, to be able to help with that. Also, potentially run drop-in centers or respite care centers. These are things that they can do that are non-clinical. And we lost that bill last year because of funding. The other bill that we lost because of funding was our bill to secure transport. This was to have a third option that would eventually replace the other two options, we hope. Currently, it has to be an ambulance, which is cost prohibitive, very expensive, or it has to be a patrol car, whether that is county sheriff or whether that is city police, both of which are not ideal for an individual who is in a crisis situation. We were hoping to have a private company have a unmarked van that would have what was needed in the van and a couple of folks. It could be a peer, it could be a medical professional, as well as a licensed clinical social worker, to be able to provide for transport that did not escalate the problem and was not expensive. And we lost that bill, and we are bringing them both back. I'll talk about that in a moment, but those were two we lost. We also experienced reductions in behavioral health funding, and we had a terrific year in 2019 where we were able to get monies for expanding services for pregnant moms and postpartum moms to be able to have some counseling. And we also had for substance use disorders, we got expanded. And then mental health counselors in the schools, we had quite a bit of money attached to that. When we had the economic downfall in the Joint Budget Committee and the legislature had to cut, it was close to $3 billion out of the budget. It was a hefty amount. They had to take all the money that was not expended in these programs and bring it back into the general fund to help balance. So we lost those expansions that we were hoping to have as well. Next slide. And by the way, on that, the bills that passed stayed in statute, so they're not nullified, they're there. So when we start to recover from this economic downturn, we can start plugging in money there again. So we didn't lose the bill, but we did lose the funding for it. So the federal government, as you may know, created the CARES Act funding. This was way back last June. We were part of a number of nonprofits who created a bill, House Bill 2014-11, if you wish to see it. And it included all of these pieces in it. So this was $15 million that we took out of the federal CARES Act funding for all the bills and for programs that we as agreed to as mental health nonprofits to have. So there was a little over $3 million from mental health centers to work with students during the summer and fall when they were not in school. $3.5 million for substance use treatments. We got $2 million additional for school-based clinicians who could use telehealth or other means to work with youngsters. $3.8 million for co-responder programs. So we were able to invest some more in terms of crisis response. Opioid antagonist bulk purchasing. So we were able to get those established throughout the state. Mental health first aid. SBIRT, which is screening for substance use and referral to treatment. And then we were able to get $125,000 for the Safe to Tell program, which was how we got that bill passed, because we were able to get the funding out of the CARES Act. Now, all of this money has to be expended by December 31st. So it's coming up now. All of this will be gone as of December. This is why we're really concerned about both more federal stimulus dollars that we're trying to get mental health funding in, hopefully to replenish some of this. So for the 2021 legislative session, which starts January 13th, we have our two bills that I mentioned to you that we're bringing back, the peer support specialists and the secure transport. We're very encouraged because we have, we think we have secured the funding necessary to be able to implement it. We have some interest on the part of both a state agency and a foundation that might be able to help us with this. So we're encouraged. Then we're introducing two new bills, 988 Suicide Prevention Hotline implementation. The federal government passed and President Trump signed in November, Senate 2661, which establishes 988 as the nationally recognized phone call number that will be similar to 911. That's recognized nationally. This will be 988 for suicide prevention and for crisis response. So we are in the process right now. I have model language from our national Mental Health America to introduce in January. Mental Health Colorado will be sponsoring this bill. We'll be introducing it in January. And it provides for a number of things, but authorizing it in our state to be up and running, to work with the telecom industry to get it up and running. By the way, there are T-Mobile is already recognizing 988. They really jumped on it fast. So it is great. There are, if you die, I wouldn't want to encourage you to do this because I don't think it's moving, but if you have T-Mobile, 988 will be connected. But there are a lot of areas in the country where broadband is not available. And this does require broadband because the old system, where some areas, some pockets of, especially, they tend to be rural areas of various states, including our own, 988 would be recognized as a prefix, but it would not connect because it's waiting for the rest of the number. Under the old system, under broadband, it is recognized. So we have to work with a broadband in our state to make sure that rural areas of the state are able to accept it. We also are working with our current crisis response line. They are needing to ramp up. They're going to have more staff because a number that's that easy to remember, there are going to be more calls. We expect that. And then also the bill that we're introducing, and it does coincide with the federal law. The money needs to be used for crisis response as well. So if someone calls in, it's not enough to say, okay, we hear you, we're on the line with you. You need to have the capacity to send out crisis response. And so that we need to beef up too. Now we're ahead of a lot of states because we have a crisis line already, even though the number is awkward. And we have a crisis response already, but it isn't going to be enough. So we're looking at asking the legislature to place a surcharge on our phone bills. All of us have a surcharge right now for 911 on our phone bills. Mine is $1.30 a month. I don't know what it is for anybody else. We're looking at that to start collecting that money as a surcharge in order to be able to, when we roll out 988, have that source of money ready to be able to expand and make it work properly. The other bill that we're introducing is trying to limit the use of solitary cells in the jail system. Currently, individuals who are in crisis and sometimes individuals who have developmental disabilities are placed in solitary confinement, which could be up to 24 hours a day in solitary, which can exacerbate the mental health of anyone who's there, particularly if someone's in crisis. So we're working with law enforcement now to try to come up with parameters on when someone might have to be in solitary for their protection, but also not use it as a management tool at the expense of the individual who's in the crisis. And I don't know, Vincent, did you want to add to that?
No, not necessarily, Mo. Thank you.
Oh, okay. I just noticed you popped back on video, so I thought, oh, you're coming in. Okay, and as I mentioned, we have high probability of funding. So, did we skip a slide there, Flora? Can you go back one, please? There we go. Thank you. So you may have seen in the paper that on Monday, we had a special session. The governor can call a special session, or the legislature with 2/3 vote of both houses can call themselves back into special session to address a particular issue, but it has to be limited to a particular issue. And so in this case, the governor called the legislature back to appropriate monies for the coronavirus downturn, because the federal government has been so lacking in creating a second stimulus, actually be the fourth stimulus package. And as you saw, the CARES Act money goes away in December 31st. He wanted to do something for this that we can do here at the state level. And so he identified about, I think it was $220 million in the end was what was appropriated. So they came back on Monday and they worked on 10 bills. Well, actually, they had quite a few bills. They had 40 some odd bills. 10 passed, and they were finished Wednesday night. So that's 3 days, which shows you that if you're focused and you really, get going and you get things through, you can get bills passed that are constructive within 3 days. And that's exactly what they did. So these are some of the highlights of what they did. $350 for individuals who qualify. These would be folks who are laid off because of their business being closed or greatly reduced. Sales tax relief. And what this does is businesses that are open can retain the sales tax that they are collecting for the state, rather than remit it to the state. So that will help them. And this is good from November through March, I think it is. So we will lose as a state these sales tax monies, but it will help keep those businesses open. And there is a max, it's up to $2,000 a month. I don't think too many of the restaurants are going to realize that, but funding for childcare facilities. These are grants to existing childcare facilities as well as to new ones starting up. Broadband funding for schools. And this one is of special interest to us because this broadband funding is for school districts that don't have broadband in order to be able to do virtual learning for their students, so they can build that in. But and of course we support that. But what was exciting for us is that it also included behavioral health and treatment and counseling. So not only is it instruction for academics, but it can also be used for the counselors in the schools to be able to talk with children at home about their mental health. So I was really pleased to see that. And then rental assistance. So this link, and you will all get this PowerPoint, I believe, or it'll be up on our website, either way. This link, it will take you to the 10 bills that passed, the text of the bills, the financial, analysis, and also how the legislators voted on the bill. I'm pleased to say that by far and away, the majority of these bills were bipartisan, both in sponsorship and in votes. It was constructive that way. So I was pleased to say that. So the legislature, as I mentioned, is going to start on January 13th. We don't quite know what they're going to do yet. I'm not sure they know quite what they're going to do yet. They have options. So they can begin in January in person. I would bet they will, because they want to swear in everyone who got reelected or is newly elected. And there's a ceremony around that. The Chief Justice of the Supreme Court comes in to swear everybody in, and it's a tradition. So my guess is they will at least do that on January 13th. But they could continue and stay in person all session, or they could repeat the virtual from last year. So they can come in person, get sworn in, and then go to virtual. They could recess for the months of January and February, and since they're thinking that the vaccines will all be out and about in March or whatever, and then maybe come back in March and go back in person again. These are all options they have. We just don't know at this point what they will do. But we're going to be active no matter what they do. So what we are going to be doing, obviously we're going to be working on passing our priority bills, the 4 that I mentioned. We will be supporting other bills on mental health as they come in. One that we know for sure is coming back this year is establishing an annual mental wellness exam. Representative Michelson-Janae had that last year. We were very supportive of that, testified in favor of it. It did pass. It got to the governor. He vetoed it. He vetoed it because he felt that there would be a high increase in premiums. He has since then had the Division of Insurance hold meetings, of which we participated as Mental Health Colorado, to see would it or would it not in the private sector increase premium costs. Seems to me that it would be very small from what I gathered from those meetings. Anyway, it's coming back, so we're going to give it another try. But the one thing we have to be really aggressive on is following the budget closely to make sure that when there are cuts, and there will be again this year, that mental health is not cut anymore or substance use is not cut anymore. The Joint Budget Committee is meeting now. They're starting to look at the various departments and what they're recommending. And so Lauren Snyder and I are following those. And we will certainly send out an email to all of you as Brainwave members saying, get a hold of your legislator right now because they're looking at cutting something. And so we will be on top of that and we will keep you apprised of that as well. So, role of the brainwave. Some of you know this already. Contact your legislator and ask for no more funding cuts. The newly elected legislators and those that are brand new to the legislature, I have those in bits and pieces, but there is no comprehensive list that the Colorado State Capitol has released yet for their contact information and all. I will get that to you as soon as I have it, and as soon, because it's always good to say hello to them anyway and introduce yourself. In terms of legislators, when we have committees that are hearing our bills, we will send you information on judiciary bill meeting is on Tuesday at 10. Here are the members. Please call them and ask them to vote for the bill that we have in front of them or whatever, or occasionally vote against a bill. We don't have too many of those. And then if you wish, offer to testify on behalf of our bills. I can tell you for a fact that all of the bills we passed in 2019 were, and several that we got passed in 2020, had a brainwave member, at least one, sometimes three, testify in favor of them. And that shows you the power of your testimony. So when you come into the legislature and you take that time and you sit there and you tell them this is important because here's how it would affect me, my family member, good public policy, whatever, they listen to that, and they you did have influence. So pretty good record when 8 bills that we had in 2019, every one of them passed with funding, and every one of them had a brainwave member or two speak in favor of them. So that was pretty good. Now, if they go virtual, I will be in touch with you on how to do that. The Capitol set up links on how to submit, when to submit, how to work all that out. It was a little cumbersome at first. I think they got it down by the end of the session. I will keep you apprised of how to do that and provide you with those links if we do indeed have to go virtual. So meet with your newly elected state and House members. As I say, I will get that information out to you shortly. Watch for our emails on contacting legislators. And if you think you might want to testify, prepare your written comments ahead of time. And Aubrey and I are happy to help you with those. You can send them to us and we can, you have to be concise because legislators aren't going to read a 4-pager, but they will read something that's a bullet point all the way down the front saying, this is that, that, and that, and please do this as a result. And so we can help you with that. And we can keep you apprised of when and how to share your written comments. And I think that's it for me. And now I'm going to hand it over to Vincent. And thank you again for being here.
Thank you, Mo. Another thing that you can do is check out our new campaign, CareNotCuffs, at CareNotCuffs.org. This is an effort to raise public awareness and public demand for healthcare in response to health needs, so that we can end the criminalization that so often results from having inappropriate law enforcement response to healthcare crises. So have a look at CareNotCuffs.org and sign on to the petition that we've created there, which will go to leadership all over the country in 2021. So I'm just going to share some of the tips that we've been sharing in the context of this pandemic. It's funny that this slide says that the legislators are taking precautions, because what I was sort of scandalized to hear is that they opened up for the special session on Monday, convening in person in the warm, stuffy rooms of the Capitol, and not all of them wearing masks. And so part of me sort of expects that in another week or so, we're going to hear about legislators who are testing positive as a consequence of their incautious behavior. But I do have some recommendations I've been sharing about health. And Flora, if you want to go to the next slide, so I remember what order we're going in here. The main thing is the social closeness, and it's so unfortunate and kind of indicative of the nature of our community that we rapidly settled on social distancing as what we were ready to do. We don't need social distancing. We need social unity and solidarity and support. We need physical distancing for our physical safety in the face of a transmittable virus. But we need to band together and be there for one another as never before. And that's been doable across distances since the dawn of time through things like letter writing and more recently through phone calls. And, you can still see people. Just keep your distance and keep a mask on, but do make time for that social closeness. This is an important mental wellness priority. Laura, what's the next slide? There are these regular steps that we as human creatures have known to take for as long as humans have had awareness about these kinds of things. Getting outside and consuming some of that vitamin C that falls so easily from the Colorado skies, this is good medicine. Turning down the volume of media reporting and the endless streaming of human news and replacing some of that with news from nature, and listening to the sounds between the sounds outside. That is the silence between the bird calls, the wind in the rustling leaves of fall and things like that. This is also extremely good medicine for your mental health, way better than scrolling through Facebook or Instagram, or listening to more newscasts. Taking some time to meditate, or pray, or whatever it is that you do that puts you back in touch with reality. Meditation has been described as a long, loving look at reality. And reality for most of us is limited to what is the present and what is present to us, things over which we actually have some actual control. Make time for that. More good medicine. Again, a way of maintaining social closeness is by reading books that inspire. This is how we communicate with past people and present people and feel understood and supported. It's good things to do. And don't let your mind be the only part of your body, the only part of you that is moving. Get the body moving, and the mind's movement will adjust itself to be more comfortable and in tune with what actually makes sense for us. So what else do we have, Flora? One of the key things to do for mental wellness is to be of service to others. And, I always think of what the flight attendants say on the planes, where they talk about the oxygen masks falling from the roof, and point out that the first thing you need to do before you help somebody who's having trouble is put on your own oxygen mask, so that we don't have two people who are having trouble breathing. Put on your own mask, but then don't forget that there's somebody next to you who needs some support. Turn and help somebody else with their oxygen mask. This will make your oxygen flow feel all the more thorough and supportive. Your own well-being will benefit. Next, Flora. Uh, and then, of course, as we've seen already in data and reporting, times like these result in a heightened risk of harm from substances that people use to medicate themselves. And, I found that one of the most amusing moments in the not at all amusing pandemic was when Mayor Hancock in Denver threatened there for a moment to close all of the city's liquor stores, and suddenly there were lines popping up everywhere in plain indication that people do indeed resort to substances such as these to comfort themselves. But these are potentially harmful substances, and we need to be alert to those harms and protect ourselves and each other from coming to harm. So there's a good screening for substance use available on our website at mentalhealthcolorado.org. You can take it for free. It's completely anonymous. It's a good check-in about substance use to be able to understand where you are on a spectrum of safety or concern, and then you can take some appropriate steps in terms of getting some support. What else? Do I have another? Yeah, again, your support for our mental health advocacy, sharing your personal story. There's nothing more compelling than a personal story. We're happy, Aubrey and Flora are happy to consult with you on getting that story just right, if that's helpful. And again, reaching out and contacting your elected officials at all kinds of levels to promote so that they will prioritize mental health. And so many key folks have a role to play there, from your district attorney, your sheriff's office, your police department, county commissioners, city councilors, school district superintendents, school principals. All of these people need to hear from us that mental health matters and that they should be paying attention. And then again, sign that petition at CareNotCuffs.org. What else? Do we have another slide? Yes. So a couple of things. That team of supporters, we're in a crisis. It's really important to know who else you have in your lifeboat. Who are the people in your life that are the ones that are part of your own sort of informal therapeutic network? Make sure you think about who those folks are and let them know, and make sure you spend time to cultivate them and be there for them in good times as well as times of crisis. That kind of constant relationship maintenance is what keeps us afloat and keeps us going. Obviously, if you're concerned, seriously concerned about your own mental health, feeling like you're arriving at a crisis point, or that someone close to you is, don't hesitate to reach out to Colorado Crisis Services. You can call them or text them, and they're available 24/7. And crisis, you don't have to wait till it's an acute crisis. You can call with concern, and the needs will be clinically assessed, and you'll be reassured or redirected. And then there's a bunch of different resources, some pandemic specific, on our website. Please have a look at those and share them. Do we have another slide?
I think that's the last slide for today, and then we're going to move into our Q&A. Do we want to open it up for questions about Vincent's portion? Any questions there? Okay, how about questions for Moe or Vincent?
I have a question. I believe this might be best directed to Moe about the 988 suicide hotline. I work with the disability community and know with the deaf and hard of hearing population that that they really need text options for services like these. And this hotline sounds incredible. Very excited about it. I'm just curious if there are plans for there to be inbuilt an option for folks to text if they can't hear or if they prefer to text.
Very good question. Currently, the Rocky Mountain Crisis Partners, who runs the crisis line, has a text option. And they've seen a significant increase in the number of calls or texts, that I should say, that they're getting when they went with that a few months ago. I can get that text number to you, but that will not change. That text will stay with 988. 988 will be substituting for the 10-digit number that we have right now, which is so long, nobody remembers it. And so, but the text will stay.
Great, thank you.
Yeah, you bet. Good question.
I have a question for Moe. Do you have a sponsor for the 998 suicide hotline bill?
Yes, we are going to start the bill in the House, and we're having a conversation with the person. She has not yet accepted. So we're going to meet with her on Wednesday and discuss the bill and what we're anticipating in terms of the potential complexities with the telehealth piece as we get it going. So we were meeting with her, and then Monday morning I'm meeting with a senator who has expressed interest but has not yet accepted. But Susan, if you have some ideas, feel free to send them to us.
Okay, thank you.
We would like to have co-prime, meaning a Democrat and Republican senator and a Democrat and Republican House member. That's our plan.
Sounds good.
Mo, when does the Safe to Tell bill go into act? So, like, when will that switch actually happen?
It's in process right now. The Attorney General's office houses Safe to Tell, and they've been doing stakeholder meetings on getting that switch going. And they're writing the rules for that right now. And they could be close to having that done, but I don't have a date. So let me find that out, and I can get that back to you. If you send me an email,
Yeah, that would be
and
great.
I'll get that information back to you. I know it's underway. I don't know if it's actually started.
Thanks.
Mhm.
Any more questions? We'll be sending a follow-up email, and I think everyone should have our contact information as well if you have questions for Mo or Vincent or me.
Or any updates anybody else wants to share? Anything we should be thinking about?
Great. I think Vincent's going to close us out with a little reminder about Colorado Gives Day coming up next Tuesday.
That's right. Thank you so much. Yep, Colorado Gives Day is coming up, and our advocacy for mental health completely depends on the philanthropy and generosity of Colorado donors. So we appreciate your support in that regard, and to helping us expand our reach in terms of talking to people that you know about our work and trying to find some more brainwave advocates for us. Don't let a important mental health story go untold and unrepresented in our advocacy.
Thank you all. Hope you all have a great Friday.
You too.
Thanks so much.
Thank
Bye.
you. Take care.